And there is hope this morning for millions of couples struggling to have a baby. A new successful treatment option is helping, get this, up to 90% of all infertility cases. Dr. Robert Kaufmann, the medical director of infertility services at Andrews Women's Hospital at Baylor All Saints in Fort Worth, is right here to talk to us this morning about these treatment options. And he also brought along Sonny and Troy Austin, two of his patients who are now the proud new parents of baby Luke. How y'all doing this morning?
Great.
Doing great.
Now, this has been a long road for you.
Yes.
How did this start? And I say you, this has been a team effort. All three of you, really.
Definitely.
But let's start with you and what you went through.
Well, Troy and I struggled with trying to conceive on our own for a couple of years before we referred to Dr. Kaufmann. And after we referred to him, I'd just been diagnosed with having PCOS, polycystic ovarian syndrome. And so we went to him, discussed our options, but we really weren't quite ready to dive into the whole fertility treatment yet. So we wanted to really kind of go more of a natural route. So I sought out acupuncture for a couple of years, and that was unsuccessful as well.
What kind of difficulties did you have?
Well, just as far as just personally, I was not able to ovulate on my own. So after, like I said, going through a couple of years without being able to ovulate on my own, finally through ultrasound, that's when the cysts were discovered on my ovaries, and they realized that I had the PCOS.
And you had experienced a miscarriage at one point.
I
You
did.
really had a long road. What, about 6 years?
Yes, 6 years
of
total.
trial and error.
6 years total.
And look at the happy result now,
Yes,
though. Look at the proud
finally paid off.
papa.
Distance pays off.
And what was this like for you?
It was really a challenge, but it was more of a challenge for her, and I was just concerned about, her feelings and what she was going through. I was really ready to adopt. I mean, I was okay with the adoption process, but I'm glad we didn't make that choice.
Dr. Kaufmann, when does someone need to go see a specialist?
Well, Kristen, generally what we recommend if a couple are trying to get pregnant for a year and unable to, probably need to be evaluated and potentially treated. There are exceptions to that. For example, if somebody's a little older, you need to be careful with that. But if they're older than 35, probably about 6 months of trying to conceive, and probably if you're trying to conceive after the age of 40, after about 3 months, you should probably be evaluated and potentially treated.
Now, what is it like when someone comes to see you? How do you start that diagnosis?
Well, I think it's very important to spend time with the couple initially, talking to them, getting history, doing a very thorough physical, and then we kind of look at what other kind of treatment options there might be and evaluations. And one of the evaluations would be to check a semen analysis, make sure the sperm are fine. There's a test called a hysterosalpingogram where we check the fallopian tubes to make sure that the tubes are open. Then we sometimes do some hormone testing to see how the ovaries are functioning.
Now, do you primarily focus on the woman or also the man? I mean, this is, again, a team effort like we joked about, but it really is.
It is a team effort. They say about 35% of couples that are having trouble getting pregnant, 35% of the time it's a male issue. So it's very important to evaluate the male. And about 50% of the time it's a female issue, and about 15% of the time it's a combined issue.
All right, break it down for us. What are our options?
If you kind of look at the options, first of all, you want to be economical and you want to be efficient, and you need to individualize. But specifically regarding the treatment options, the first treatment option would be ovulation medications if they're not ovulating. The second treatment option would be surgery. Surgery would be indicated in situations where fallopian tubes are blocked, for example. Third option would be something called artificial insemination, or IUI, where we insert sperm inside the womb. And the last treatment option would be in vitro fertilization, which has truly revolutionized our field as far as success rates.
And how was Luke conceived? By in vitro?
In vitro.
Yes, in vitro
Ultimately
fertilization.
in vitro.
Yes.
But it certainly wasn't your first step. You went through a lot of options, and
Yes.
look at the success. Congratulations
Thank
to
you
you
very
all.
much.
To you
Thank
all,
you.
I say.
Exactly.
And what a little star you are, too. He behaved so well
he's
for us.
doing well.
How old is he? 7 weeks?
7 weeks
Yeah.
tomorrow.
All right.
Yes.
Well, happy birthday tomorrow,
Thank
Luke.
you.
And to get more information on infertility services at Andrews Women's Hospital at Baylor All Saints Medical Center at Fort Worth, you just have to call this number. It's 1-800-4-BAYLOR, or go online and visit BaylorHealth.com. And we